Here's my patient chart. I'm going to go ahead and knock. I'm going to walk into the room. Hi, Ms. Smith. How are you?
Good, thanks.
Perform hand hygiene. I'm going to don gloves. I'm Sarah. I'll be your student nurse today. Can you verify your name and date of birth for me, please?
Sally Smith, 42501.
All right. If I can just see the medical bracelet on your wrist. All right. I'm verifying her name and date of birth and her medical record number with the chart. Thank you.
Mm-hmm.
Do you have any allergies to food, latex, tape, the environment, any medication allergies?
No.
Right. I verified that with the chart and with my knowledge. Great. Then I would go ahead and take her vital signs for the purposes of today. They've been provided for me. Her blood pressure is 120/78. Her heart rate is 72. Her respiratory rate is 18. Her oxygen percentage is 99%, and her temperature is 98.7. These are all within normal findings. Ms. Smith, are you in any pain today?
Yeah, I have knee pain.
Okay. When did this knee pain start?
Like 2 weeks ago.
Okay, and which knee is it and what part of the knee is it?
It's my left knee and it's like on the inside.
Okay, so the inside of your left knee.
Mm-hmm.
Okay. And does this pain come and go? Is it constant?
It comes and goes.
It comes and goes. Okay. And is it a throbbing pain, an achy pain, a sharp pain?
Yeah, it's pretty sharp.
Okay. And is there anything that makes it worse?
Moving around or putting pressure on it.
Okay, what makes it better?
Keeping it still.
Okay, keeping it still. And then have you tried any at-home remedies or any over-the-counter medications or treatments for it?
Ibuprofen, but it hasn't helped very much.
Okay. And then on a scale of 1 to 10, 0 being no pain, 10 being the worst pain of your life, what level of pain are you in right now?
Like a 5.
Okay, I'm sorry to hear that. I'll let the provider know. Okay, and then can you just tell me again who you are and where you are today?
I'm Sally Smith and I'm in the hospital.
Can you tell me why you're here?
I'm here for my knee pain.
Okay. And then can you tell me, is there any holiday coming up? Is there anything that happened recently? Anything you're looking forward to?
Halloween's coming up in like a month.
Okay. So my patient is alert and oriented ×3. Throughout this part of the assessment, I've been noting that she appears symmetrical and she's not in any distress except the level 5 pain in her knee she's described. Then I'm going to go ahead and I'm going to look for any equipment. For the purpose of this video, my patient does not have any equipment. If she had a nasal cannula providing oxygen, I would check for breakdown around the nares, the face, the ears, or any like rashes or anything in that area. I would check the tubing to make sure there were no kinks and that she was getting the proper flow rate of oxygen. If she had an IV, I would check the IV site. Are you in any pain or discomfort at the IV site? No. I would check for swelling, edema, any irritation. I would check to make sure that what was in the bag was the provider's orders and that there were no kinks in the tubing. If she had a urinary catheter, I would check to make sure it was still fully inserted, that there was no skin breakdown, that there were no kinks in the tubing, that it was properly attached to her leg, and I would note that it was attached, that the bag was attached to the bed frame, and I would note the color, odor, consistency, and amount of the urine. Okay, and then we're going to move on, and I'm going to just start the hands-on assessment, all right? I'm going to take a look at your scalp and your hair. Her hair appears evenly distributed. There appears to be no rashes, breakdown, or skin lesions. And then just looking at her skin, it is even in color. It seems normal for her, or predictable for her ethnicity. And then if she had any wounds, I would double check and see if she had any. I would note the color, if there was any drainage, if there's a drain attached, and kind of how they were progressing and how they were healing, and if there were any dressings on them. And then I'm just going to go ahead and I'm going to feel for your temperature. Her temperature is warm and is equal bilaterally. And then I'm going to go ahead and if I could just borrow one of your hands, I'm just going to do a little pinch on the top of your hand here. And I'm testing for skin elasticity. There's no tenting, so her skin elasticity is good, which is a normal finding, and there's no tenting. I would check for edema. She doesn't have any, but if she did, I would check if it was pitting or if it was non-pitting. Okay, and then I'm going to go ahead, if I could borrow one of your hands, then I'm going to do this on the other hand. I'm going to press one of your nails for 5 seconds, and then watch for refill. Checking capillary refill. I did this on 1 finger of each hand and 1 toe of each foot. Refill is under 3 seconds, which is a normal finding. I'm going to go ahead and I'm just going to take a look at your ears. Looking at both ears, I see no redness or swelling or any drainage. Then I'm going to just take a look at your eyes. If you're going to have you look straight ahead for me. I'm checking her pupils. And if you could just follow my pen light with your eyes, not your face, or your head, rather. Her pupils are equal around and reactive to light, and they accommodate to my pen line movement. Then I'm going to have you go ahead and look up for me. Right, her nares are pink and moist, and there appears to be no drainage. And I'm going to have you go ahead and open your mouth and say ah.
Ah.
All right. Her mucosa is pink and moist, and her uvula rises to her midline. And looking at her face, I noted that there are normal findings of the nose, so no drainage. Looking at her eyes, I noticed that the conjunctiva was pink and moist, and that the sclera was white. Then I'm going to go have you smile for me. All right, thank you. So her face was symmetrical, and her smile was symmetrical. I'm going to go ahead and I'm just going to take a listen to your lungs. So I'm going to have you sit out for me and turn the other way. Just put your back towards the screen here. Great. So during this assessment process, I've noticed she's not using any accessory muscles to breathe, to aid her breathing, and that she doesn't appear to have labor breathing. I'm going to put my hands right here, and I'm going to have you take a deep breath for me. Inhale and exhale. Right. Her chest wall rises and falls equally and bilaterally. I'm going to go ahead and I'm just going to listen to your lung sounds. I'm doing this with the bell of my stethoscope. So what I'm going to do is each time I place this on you, I'm going to have you take a big inhale and exhale. Let me know at any point if you feel lightheaded, okay? Go ahead and inhale. Exhale. Inhale and exhale. So I'm doing this in a Greek key pattern. For 8 to 10 breath sounds. You still feeling all right? Perfect. One more. Right. Her breath sounds are clear. There was no sound of any rhonchi, crackles, wheezing, or stridor. Again, there's no accessory muscle use. If she had an incentive spirometer, I would demonstrate usage and educate her on how to do it and have her demonstrate the correction. I would not demonstrate the usage. I would have her demonstrate usage after I explained to her how to do it. I'm going to have you turn back the other way for me. If you were, in position. We're going to just examine some elements of your cardiovascular system. Okay, I'm going to start with some palpation. I'm going to start with the palpation of the carotid artery. Doing this on both sides. There's no sign of any thrills. I'm going to go ahead and I can just see both of your wrists. I'm palpating her radial pulses individually and then together. I'm going to do the same thing with her pedal pulses. Her pulses are equal and bilateral. They're a steady rate and rhythm, and they're 2+, which is a normal not bounding pulse rate. And then I would palpate for her PMI, her fifth intercostal space, the midclavicular line, and note that there were no lifts or heaves, which is a normal finding. And then I'm going to go ahead and I'm going to also take her carotid. I'm going to use the bell. So what I'm going to do is I'm going to have you take a big inhale, then I'm going to have you exhale and hold your breath for me. Okay, we're going to do one on each side. Inhale and exhale, hold your breath. Perfect. And in doing this, I didn't hear any bruits, which is a normal finding. Right, I'm going to go ahead and listen to your heart area here. I'm going to start in the second intercostal space with her aortic area and her right sternal border. I'm going to do her second intercostal space, left sternal border, just her pulmonic area. I would first do this with the diaphragm. So I'm going to start over and just do the aortic, second intercostal space again, and then pulmonic. And then I would do the third intercostal space, left sternal border, Erb's point. And then I would do the fourth intercostal space, the tricuspid, left sternal border. And then I would also take her mitral area, fifth intercostal space, and the clavicular line. Then I would do this again with the bell, as I had started with earlier. So the aortic, pulmonic, herbs, tricuspid, and then I would do the mitral area again. And in doing this, I noted that her heart sounds, S1 and S2 were present, S3 and S4 were not, which would be abnormal if they were. That they were even, it was an even rate. Yeah. And then I'm going to go ahead and I'm going to have you lay down for me. That's all right. Get comfortable. Have you had any nausea, vomiting, or diarrhea recently?
No.
Okay. And when was your last bowel movement?
This morning.
Okay. What was the color?
Brown.
And the consistency of it?
Soft.
Okay. And those are normal for you?
Yeah.
All right. And do you have any dietary restrictions?
No.
Okay. So in looking at the patient, she is symmetrical. Her stomach is symmetrical. It's flat and there are no pulsations. So I'm going to go ahead and I'm going to listen. So I'm going to listen with the diaphragm. We'll start in the right lower quadrant. And move in a clockwise direction. I'm listening for 5 to 15 seconds or until I hear a vowel sound. Right. So I heard vowel sounds in all 4 quadrants, and they were normal active, and a normal high pitch, not too high pitched or anything like rushing. And if I didn't hear a vowel sound within the normal time, I would have to wait a full 5 minutes to try to keep listening in each quadrant until I declared that she would have absent vowel sounds in any of the quadrants or in all. And then I'm going to go ahead and I'm going to just palpate. So let me know if you have any tenderness or it starts to hurt or anything, okay? So I'm going to start with the right sternal border with light palpation. Right lower quadrant, excuse me. Not sternal border. I'm going to do a little harder. Did you feel any tenderness? Okay, there was no tenderness, no masses. I didn't feel her guarding or anything. And her stomach was soft. And I would have done this before palpation. I'm going to go ahead and listen to your aorta with the bell. And listening to her aorta, there were no signs of any bruits. I'm going to go ahead and I'm just going to have you sit back up for me. All right. And has your urinary frequency changed at all?
No.
Okay. When did you last urinate?
A couple hours ago.
Okay. And what was the urination process and the urine a normal color and everything? All right. And then I would monitor the patient's intake and output. Okay. Sorry. And then I'm gonna go ahead and do you have any numbness, tingling, or swelling in any of your extremities? No. All right. And then if you could go ahead and squeeze my hands for me. All right. And then if you could just flex your toes upwards against my hand, and then do the same thing with the other foot. Okay. And then if you could push down like you're stepping on the gas on my hand, push down here. All right. And then in doing so, I would rate her muscle strength as a 5, which is full range of motion against resistance. And then I'm gonna go ahead and I'm gonna lower the bed. I'm gonna put up 3 of the side rails. I'm gonna make sure she has her call light. Do you know how to use the call light? Yeah. Call us if you need anything. Is there anything else I can do for you? All right. I'm gonna perform hand hygiene and I'm gonna exit the room.